Good afternoon, Eva. This is Erin. As of right now, you're the only TAC member I currently see. Oh, Lisa's coming in as we speak. So we'll give it just a few more minutes to see if we have anybody else.
Okay.
I do know Dee's not going to be in today.
Okay.
Hi, guys. Sorry.
Hi, Lisa.
I was on a meeting. I said I have a hard stop, but it didn't work. They weren't listening. But I'm here now.
No worries. Good afternoon, Lisa. This is Erin. I was just letting Eva know, as of now, it's just the two of you on as members. So if you want to give it another second longer, or if you want to go ahead and start in the interest of time with our presentations, we can always come back and approve minutes if you would like to move forward.
I would like to do that because I want to respect the time that our guests. I mean, they do a lot of work preparing these for us, and we respect their efforts. And I mean, Dr. Stone, are you okay with that if we go ahead and let them start with their presentations? Okay.
Absolutely.
So thank you. Welcome, everyone. Happy holidays. Thank you for being here. We really appreciate you being here. And whoever wants to start first, I guess, unless there's an order of participation.
If you don't mind, I'll go through who I've made a co-host first, if that works for
that's
the
fine with me.
NCOs. Okay.
We're ready to go.
Victoria with Anthem, you're up. That's the
Thank
downside of being
you.
the first person in the chat.
No worries. Thank you. All right, let me share my screen. Let's see here. Okay, can you see my screen?
Not yet.
Okay.
Here it comes.
There we go. I see you now.
All right. Great. All right. Thank you so much. I'm Vicki Meska. I am the Director of Healthcare Management Services for Anthem Kentucky Medicaid. And I'll be walking you through how members are educated on their benefits and incentives. What I want to talk about first is our member engagement. So at Anthem Medicaid, we're fully committed to a whole health model. So improving the health and well-being of the members in Kentucky. And you'll see later that we do have some of our benefits are sort of compartmentalized, or you'll see the benefit of certain chronic conditions that we have incentives for later in the presentation. So how do our members actually get access to these incentives and value-added benefits? And there's several ways. One is through the Anthem Medicaid mobile app. So they can log into our Sydney app, and they can have access to multitudes of things like education, case management programs, but they can also get familiar with their value-added benefits and healthy rewards incentives. They can also access these benefits from home just by logging into also our public portal, meaning our publicly faced on the internet portal. They actually have to log in privately to their account, and then they'll see the benefits and the rewards. Also, we have a monthly member orientation webinar where we have our team at Anthem will welcome new enrollees into the plan. They can log into the webinar, and we go through the whole list of benefits, also value-added benefits and healthy rewards. And this orientation is offered in both English and Spanish. And then we also make our community education available everywhere. There are population health teams are outreaching many community-based organizations throughout the state, and they have done numerous presentations to those organizations, informing them of our incentives and healthy rewards so that they can get the word out to the members. And then also we have an entire team of community health workers that are dedicated to providing and helping with social determinants of health. And along with assessing for that, they will connect them to, again, value-added benefits or incentivize them to do certain things to get healthy rewards, certain preventative care. And then lastly, we support our members through our provider connections. We have a lot of meetings directly with providers and provider groups, also facilities, where we let them know, we go through the value-added benefits and the healthy rewards. And then they can also, if they prefer, just to log in and get training through the virtual platform for providers. So as you can see here, there's different categories. For example, maternal and child health. A member can receive up to $175 in gift cards to purchase baby items, a breast pump, Boys and Girls Club memberships, an asthma catalog. There's education and employment supports, as you can see here, like transportation, criminal record expungement, lifeline phones, a community resource link that links them to community-based organizations that help with food, clothing. There's a promoting healthy lifestyle value-added benefit. For example, for members with diabetes, that they are eligible for a fresh fruit and veggie program or home-delivered medically tailored meals. There's gym memberships, fitness coaches, and healthy families programs to help people with weight management. We also have wellness programs and such as smoking distraction kits, lifestyle aids, Amazon health and wellness gift cards, dental kits. In 2024, we'll even start providing air fryers. And then opioid supports, medicine safety kits, online well-being programs, and apps that helps with substance use disorder recovery. Our members can sign up for these programs. They can sign up by calling member services. Again, they can even go through their online account, and they can choose from an array of gifts like a Visa gift card or gift cards from a variety of retailers. They're rewarded for things like flu shots, dental exams, wellness exams, and preventative screenings. And then these are some examples when if we get a call from a member and we do our health risk assessment and we assess the member, and let's say they are pregnant or a new mom, then the case manager will go over the incentives that are pertinent to her and her needs. Same thing with someone who has diabetes or hypertension. So that way they really can take a look at all of the things that are available to them to help them keep healthy. So how many people have utilized Healthy Rewards? We had 21,000 year to date, 2023, 21,171 members enrolled and engaged in the Healthy Rewards program. And 38,894 monetary rewards were granted for active member participation in health decisions like wellness, a well child visit, suicide prevention, or a blood pressure med fill. Some of the things that our members did with the gift cards that they received, they purchased clothing, food, or over-the-counter products. And some of the top trends in value-added benefits is the Amazon Health and Wellness gift card, gas cards. We do give a $100 gas card for those that complete the health risk assessment. Medicine safety kits, fresh fruits and veggies, and healthy lifestyle aids. So that concludes our presentation here on healthy rewards and value-added benefits. Can I answer any questions for you?
I do have just a few questions, Vicki, if you don't mind.
Sure. Yeah.
So for those members who don't, and when I say this, like Lisa might have another perspective she can share when she asks questions. I'm asking my questions from the perspective of being in a school system and just what we encounter with services we're providing. So,
Sure.
So one question is what we know is a lot of our families do not have computer access. And when they do have a phone, it's a pay-as-you-go phone. And so they're not able to use apps, and they're not able to get online to register for things. But I think I heard you say they could call the member services number to enroll, correct? Okay.
That is correct. Yes.
Okay.
And we'll help them through that. Yep.
Okay. So if somebody speaks Kinyarwanda or something outside of Spanish, when they call that number, there's services, right? I think I've heard
correct.
You. Okay.
Yes, we do have interpreter services that are accessible by member services to help them through that.
Okay. So when we do, like in our school district, we do clinics, vaccination clinics at schools, and we do physical clinics.
Yep.
So what documentation would we need to provide? Because we can certainly communicate with families, you know, how they can access rewards. I would ask if there's I know we got a flyer that kind of summarized everything, but what I'm looking for is what can we hand people that would let them know how to access their rewards? And I guess that would be my question. You know, do you have a handout that we can give to people that would tell them how to access their rewards, and how do we document that for them? What service has been provided?
Yeah, so yes, we definitely have a flyer that you could provide, and we could have that submitted to the TAC committee. Now, as far as documentation, these are all based around claim submissions. So for those clinics, I imagine, are you billing a claim?
Yes, but it's through school-based Medicaid billing, so it's not going to go through your system.
Okay, that is where the challenge may lie. I mean, these are based on, so we have to, you know, account for the service being rendered through a claim submission.
Okay. So that's one thing I would just like for the TAC to be aware of, because in Jefferson County, for example, right now we have about 33,000 students who are not current on their immunizations. About 80%, 85% or so of those students are children who have Medicaid. And then we've got a small percentage that have private insurance, and then another percentage that have no insurance. And so, you know, that volume is, while we're doing vaccination clinics, it's kind of going to take an all hands on deck, but we don't have anything, if we provide that service in school, that that we can say, hey, this is a preventive health service that's going to benefit you. And here are some things that you can get for having this done. So I just want to make the TAC aware of that gap, to see if there's possibilities to address that.
Yeah, that's a good point, and something that I can take back and see if there is anything else that that could be done for those members that are getting those preventative health services.
Yeah, we do have an escalation process in place. So say the member, for some reason, it's not showing up in our system, but they have documentation that they did complete the screening. Obviously, say it was a community-based event, then we can kind of look at and review those processes and then identify what the next best action item is to make sure that they do get accounted for that healthy behavior. But with us, our processes being accounted for through in-network services and our claims, we do just need to make sure we have a streamlined approach to that. So I would just, if you want, Eva,
Mhm.
put your contact information in the chat, and I definitely
Okay.
think we can discuss, what are some avenues to make sure that, those that we either can partner, or there's ways that those members can either get a process in place to be utilize those services a little better.
Okay, well, and just to like, we're working to address it in Jefferson County. We're getting ready because it's something that matters to the managed care organizations as well. Because you're tracking that, you're trying to make sure your members are receiving preventive health services. So we're moving to an electronic health record that participants can offer to opt into, that will actually connect and work with the managed care organization. That's a really succinct way of saying it. But if the MCOs are willing to partner with them, so that's one avenue. But CMS may have another thought in mind, since those claims are submitted with a modifier. There might be some linkages. I don't know.
Agreed.
Someone from CMS might be able to, can definitely answer that better than me. But you just made me think about it when you were talking about access, because we had great success, at least in our district. We had some gift cards. When we had gift cards to give out to people, then we were able to address immunization things. And so thank you, by the way.
Thank you. Are there any other questions?
Hi, Victoria. This is Rachel Rarig with Department for Medicaid Services. I just had a quick question for you, if I could.
Yes.
Do you all have anything in place, like a feedback system for the members that are utilizing these value add benefits, to give you all valuable feedback on utilizing the vendors that you all go through, say for the free cell phone, for the computer, to make sure that it's in place where it's easy to navigate and easy to obtain the benefit?
So do we have an avenue in terms of making sure that the member has a or they feel that it's an easier way or a satisfactory way to obtain the benefit? Like, do we have sort of a satisfaction survey? Is that what you're asking?
Yeah, like a feedback loop to let you all know, because I know that some people have, I think it's Safe Link for that cell
Yes.
phone.
Right.
They can wait a very long time, if not, a year. And so it's, going through with these members to make sure, hey, you said that you needed this. Did you get this? Were you able to access it? And if not, let us help you do it. Do you have anything like that that's in place?
Now, I would say that when a member generally is trying to access something and they don't receive it, generally we get a call through our member services line, and then they're transferred into our case manager area where they assist them more closely. So, and help them. That's generally the feedback loop that goes on, unless Victoria, Jude, is there another loop? But generally, we get the feedback right back into our plan, and that goes to a specific case manager or we even have community health workers that would assist them further, and to make sure that they get the value added benefit or the healthy reward.
Okay, yeah, thank you. It might be good if it's not already in place, something like like you were saying, a satisfaction
survey.
Yeah, something where you all have a better idea of their journey, and was this easy for you all to navigate and to get? Yes or no? If no, why not? Just throwing that out there to something to take back.
Yeah, I think we could also, share that in one of our QMAC meetings too with members to see what the feedback is. Absolutely. Would be happy to do that.
That'd be perfect. Thank you.
Thank you. All right.
Tristan
other-
with Aetna, you're up.
Good afternoon. And actually, I'd like to just start real quick. My name's Tristan with Aetna Better Health of Kentucky. Rachel, I just wanted to give some feedback from the Aetna perspective. We do have a text survey that we use, not for all value-added benefits, but some of those more interactive programs that we administer a short little survey via text to our members that participate in some of our programs to start initiating some of that feedback loop. Again, it doesn't apply to every program, and we're currently working to revamp it just a bit to make sure it's going out to members, within recent usage of those VABs, because sometimes after some time has passed, folks are lose sight of the programs that they've participated in and things like that. But we do have a text survey and use many of our member advisory councils and things like that to intake feedback from members regarding those VAB services. So just wanted to share that real quick.
Yeah, wonderful. Thank you.
Yeah. Okie doke. Can you all see this value-added benefit overview screen?
Yes.
So, okay, perfect. All right, so many of the processes and things that was mentioned in the previous presentation, you're going to see similar things in place here for Aetna. So we have an array of bonus benefits that we also offer our members. This first slide here captures just some of our VAB usage with the incentive-based rewards programs being some of the most utilized VABs, nearly 12,000 members in 2023. We also have a home delivered meals program where we have administered over 200,000 meals to members in 2023. You can see some of the top gift card spend categories and top trending products that are being purchased with gift cards. Things such as utilities, telecom services, service stations like gas stations, gym memberships and clubs, and then those top trending products, things like milk, eggs, bananas, ground beef, water, veggies, bread, and diapers are some of the top trending products. And then also included there, we have completed 469 trips through our enhanced transportation value-added benefit in 2023. Also wanted to share the link here on this slide takes you out to our website where you can find a more in-depth member value-added benefit guide, which really walks through all of the eligibility criteria and exclusions for each of the benefits, because as we know, it can vary benefit to benefit. So it gives members a more comprehensive look at the services we offer and how to access each of those. So that's linked here. So let's go ahead and jump into the rewards. So we have an Aetna Better Care rewards program. So these are incentives that we provide that really require no action on behalf of the member, the claims based programs. So once those claims come through, we go out and we verify addresses and ship out these gift cards for various rewards, things like our diabetic retinal eye exams, A1C tests, mammograms, HRA incentives, well visits, vaccine incentives, and a few others that you can see listed here. We also have some programs that are geared more toward women's health. So we have a Maternity Matters program, which is partially an incentive program as well for prenatal and postpartum visits. Members can receive up to $150 for completing those prenatal and postpartum visits. They also have an opportunity to earn up to $90 to purchase a crib or a car seat, which is done through a gift card as well. In 2024, we'll also be offering a program for our high-risk pregnant members and new moms through Pacify, which is a tech-enabled platform offering that perinatal and infant feeding support, and virtual doulas. We also have a program called Period Promise. This is currently only in Region 5, members age 15 to 55. They can receive $20 a month stipend to spend on period products like tampons, panty liners, and maxi pads. We have some other programs that are geared more specifically for behavioral health. PICS Health, this is another app and human connection based program where adult members who experience loneliness and isolation can access the PICS Health platform. They can either talk to a human being to get that companionship, or they can interact with the app where they can connect with different activities, such as PICS Pets. They can get linked to different SDOH resources or be connected back to health plan resources as well. And then we have an alternative to opioids benefit. This is a gift card based benefit as well, where members can receive up to $150 quarterly for pain management services like acupuncture, massage therapy, and yoga. Chronic condition management. This is our remote patient monitoring, which is a telemonitoring program for our members that are living with certain chronic conditions. They can get access to education and self-management tools to help them monitor those conditions and keep them under control. So for this program, members receive an iPhone and then other peripheral devices depending on what condition they're managing and what the need is. So it could be a glucometer, a weight scale, a pulse oximeter, again, just depending on the need. And then the phone that they receive through this program, they can use as well to make calls and connect to member resources. We also have home delivered meals where members can receive nutritious and medically appropriate meals delivered to their home. This is a 4 to 12 week program that they can get for certain qualifying chronic conditions after an inpatient stay. The program's 4 to 12 weeks, depending on the member need. They also can get tailored nutritional counseling as part of this as well. And then we have a slow cooker nutrition. This is an online course that's taught by our community outreach team. There's 1 or 2 classes as part of the series where we offer nutrition 101 and wellness activities, healthy meals, and recipes for a crock pot. And then at the completion of the course, participants can receive a crock pot. Some of our additional programs, 2024 will have a social needs assistance program where members can receive support if they're facing conditions of extreme hardship. The program combines a financial assistance component as well as those referrals to local and community resources to help address needs when those members are experiencing hardship. We have a children's over-the-counter $15 monthly stipend to cover health and hygiene items that members can access through the link listed here. And then, as I mentioned earlier, we have an enhanced transportation. So members can receive transportation up to 10 round trips per year to things such as job interviews, job training, grocery store, food bank, and potentially other community health services. And then in 2024, we'll offer criminal record expungement with assistance with those certification fees that are tied to the criminal record expungement, up to $40 received in the form of a gift card. After school activities, so in 2024, members will be able to receive a $50 gift card to help pay for some of those after school programs such as Boys and Girls Club, 4-H, Boy Scouts, Girl Scouts. We also do a community outreach school-based program for back to school assistance where we coordinate with family resource coordinators in schools to fill backpacks with school supplies. And then we have a GED and job skills program where members can have access to a job skills training platform and get their GED. And then for those that complete this specific GED program, they're also eligible to receive a scholarship for trade school or college. And then keeping kids safe, this is a lockbox for members that have opioid medications and children in the home to help secure those for safety. We also have some SKY specific programs, birthday in a box, where the child receives a birthday box, Calm and Comfort collection for members with high adverse childhood experiences. Connections for Life. This is a smartphone, a wireless plan for SKY members that are age 13 to 17 who are not in stable placement, or they can receive a laptop for SKY members age 18 years of age or older who are aging out and need a laptop. We have a foster care duffel bag program where we provide personalized duffel bags filled with some of those hygiene items, supplies, and blankets. And then we have a LACES program for SKY members who have been identified as deaf or hard of hearing, where they can get screened for unidentified language access needs and provide recommendations. We have some new SKY value-added benefits coming in 2024. YMCA was a current one. We're just shifting to a gift card-based program for those YMCA memberships. We have some opportunities for transitional age youth for moving expenses, tattoo removal, and driver's license fees. And then the over-the-counter children's benefit is being expanded to our SKY as well. And the last slide there is just our contact information for member services. As the previous MCO mentioned, many of these services can be accessed by calling in to member services, as well as being found on our website. Any questions?
You just answered them. Thank you.
Yeah, very good. Thank you.
Perfect. Thank you.
I do have one, because
Yeah.
I don't know off the top of my head what Region 5 is. So why the period promise just in Region 5? I'm just curious.
It was just to start a kind of a pilot area. We just haven't chosen to expand that yet. That was a new benefit that we started this year.
Okay.
I'm
I was
hoping
just
that
curious.
I'm hoping at some point maybe we'll be able to expand that. But currently just focusing in that area.
Thanks.
Carrie with Humana, you're up.
Hello, can you hear me? And can you see my screen?
Yes.
All right. So hello, I'm Carrie Wilson, one of the managers with Utilization Management, Humana Healthy Horizons. And so we're just going to go ahead and present to you. We just did a group effort of all the different areas on one PowerPoint. Oh my. You all see, let's see if I can move that away. There we go. So we're going to go ahead and cover first the value added services that we're offering. And I won't read this to you step by step, but just some that I'd like to highlight that we have is Humana Healthy Humana Beginnings. So the portable crib and car seat, which I heard you say that as well, Tristan, you guys offer that at Aetna. And then meals as after delivery. We also have Pacify and smartphone apps for the prenatal care, breastfeeding, newborn infant care, cell phone services, weight management, the criminal expungement services. I'm just kind of skipping through just to highlight. The haircuts for children was something new. I think we started that about 2 years ago, maybe it was a year ago. So a lot of people have taken advantage of the haircut for children. We do have the workforce development and the GED works as well. And some of the healthy activity awards where they get rewarded back. Here's a list of the different rewards that were given. If you see the Well Child one, which was a major one, $60, pediatric, dental, wellness, prenatal and postpartum, Also for vaccines, we're given rewards back for that, and they can get to that from the app as well. And it's also claims, they can submit the claims, and then it will automatically show up in the patient's account after it's filled. The patients must download the app and create an account to earn these rewards, though. Access is simple, so you can scan, you can go to the Apple Store, Google Play to get access to it. And then member utilization. So I just kind of wanted to highlight the members that are using these services that we've had. The GED testing support, as you can see, the post-discharge meals and fresh produce boxes, that's a really nice number to see. The active phones, so access to smartphones. Portable cribs, we got 266 of those that went out this year. I think we have the date. Yeah, the date range was 1/1 to 11/21. This is what the data was pulled from. Force physical, 971. So the blood pressure devices, if you look, 360, which is great. Getting those out there. And then Go 365 utilization. This is, we'll go over the wellness and education. So for haircuts for kids, weight management, how many's been enrolled with 216, how many completed with 66. Same with the tobacco, it looks like enrolled with 138, completed 44. It is nice to see this number that A1C, over 18,000 members have utilized that screening. And here we'll go on down to the vaccines, the flu. It's nice to see that number too as well. I'm not trying to highlight all the nice numbers, but it is nice to see that they're getting out there. I think the community is doing really good. Our community outreach, our providers, our care management of just really pushing these preventative measures. Well child visits, over 15,000 utilizing it. Wellness visits, look at that. That's a great number. So, and then we just have it broken down in a graph just for easy rate for you on the 365 utilization. And the overall demographics of the different types of members and based on their age and language and sex and race. So if you look, I was kind of surprised to see that for membership, it was over 50% more women. I thought that the Spanish would have been higher, but yeah, so around 3% for Spanish speaking. And again, same with everyone else. We do have bilingual associates that can speak both English and Spanish, and if they speak another language, then we do have a language line that we bring in and we'll communicate that way. And then member education and accessibility. So again, they can scan. We've got our care management. We got Humana Beginnings. And then if we, we've got the handbook that's on our website on humana.com as well with the value added benefits on page 48 to 59. But if someone is having problems or don't have access, again, they can contact our member services and we can always help them through that process. And then just a reminder, certain value added services are claims based, so others will require members to be enrolled in the Go 365 to get that the money for it. And then integrated care management that we have right now is for example, the provider plan collaboration, ensure the patients are scheduling and attending appointments, identify, assist with some social needs if they need assistance with that, review the plan benefits and incentives to the members, just to make them educated on the different advantages that we have to help them take advantage of it. Direct referrals for high acuity, high risk patients, and increase the collaboration around the disease management and specialized initiatives that we have. We do have some specialized programs, the Humana Beginnings for pregnant and postpartum members, and then the transition team for members transitioning from inpatient care. We just need to make sure that everybody, when they're discharged, is discharged with a safe discharge plan, and that they have all the needs that they have when they are discharged at home. Dedicated care managers for members returned to society from incarceration, and then the adult guardianship oversight and collaboration. To request care management services, we have them different ways, so we can refer it here, say if the utilization management nurse reviewing that inpatient case sees that they're going to need it, they can send a referral order. And same with, say, outpatient, if they see something in the clinical that sticks out, they can always send a referral over to our care management team. They can call the care management line. We can email, anybody can email the care management or do the care management referral. The member education on the benefits. We do have the enrollee handbook. We have that on humana.com. We really tried to drive that. We have videos on there. We have it broken down to different, you might, some for kids, for EPSCT, some for adults, some for disease management. So we also have videos as well as the enrollee handbook. We've got our community engagement team that go to these different events and they'll hand out flyers. We've got our QMAC meetings with the community, and this will be in person, virtual both, and starting in 2024. And then member connections, integrated care management assessment to identify members that need the needs and connect them to the resources that we have. Then we have the Humana Healthy Horizons Kentucky website. We do have different things that show up on Facebook, and we do have YouTube videos as well. And then member education on benefits. Again, our community engagement team are very engaged with our communities in all regions. They go to these different events. They'll work with providers. They'll work with different workstations, worship, learn, and play. And our goals like growing and retaining our membership, building community and faith-based organizations and partnerships. We're branding our marketing and storytelling, developing and delivering educational resources. We've been trying to, the community outreach team is contributing to the VAS and Go 365 reward development. And we try and obtain feedback from the members when we're at the QMAC and community forums to try and understand if there's a better process or a better way to communicate to our members. And then support the quality improvement initiatives that we have to help address the HEDIS gaps. And then co-creating and managing strategic pilot programs, and then creating joint outreach opportunities with our community health workers. And this is just a graph of our region and our associates that are in those different zones. Then our provider education benefits, our value-added services, we have flyers that we send out every quarter. We send a packet out to those providers, and then we have a provider conference. And then in 2023, we had a provider lunch and learn. We had 8 of those held across the state, and 61 providers attended that. And then we have the VAS presentation as well. And then one of the questions asked to be brought here was the immigration preparedness that we're trying to implement here at Humana to help with the surge that we've had. We have utilized the CHWs and engagement specialists. We have both bilingual English and Spanish with deep ties to the Hispanic community. We help to ensure our Spanish-speaking members have access to Humana associates who can communicate with them effectively to help close those gaps in care. The frustration that they would get, and I've seen that in the past, as long as they can get someone that can understand them, and if we are not able to get someone on there, then we'll get someone on the language line to assist. We don't want anyone to be frustrated trying to get the care that they need. And then maintain established relationships with community organizations that are focused on supporting our immigration and refugees. So, for example, the American World Community Center in Louisville. And do I have any questions for Humana? All right, thank you.
Thanks.
Stuart?
I'm queued up now. Can y'all see? Whoops.
We see you.
That's not good.
Here it comes.
The slide.
Yes.
Voila. So first with a couple of questions. So Rachel, about the feedback loop. That's a very good question. I do know we have member focus groups. We have some member advisory committees. I mean, all the MCOs do. We do have an annual consumer satisfaction survey, but I have no idea if it asks any questions about value-added benefits. But anyway, I'm going to share that back with the team. That's an excellent point. I guess I would like to start with, I just got one slide here and start on the far right column, how our members educated. You know, one thing, DMS sends an annual side-by-side comparison, which is real handy. I don't know, maybe 3 pages long, 2 or 3 pages long or so with all the MCOs. And, you know, there is some variance a little bit, but a lot of us do offer, you know, a lot of the same value-added benefits. But anyway, it's really helpful so that members can see that. Typically it goes out during open enrollment. I know things are a little bit different this year because of eligibility redeterminations. But anyway, that's one way they're educated. We send annually evaluated a VAB to all, you know, brochure to all the Medicaid households. We also have a member handbook, you know, all the MCOs do, which also address added benefits. We have a brochure included in the value-added benefits is a health and wellness, which is similar to, I think, what Aetna was talking about. I'm sure others do too. We have basically a catalog of stuff you can buy at, for example, a pharmacy. And I think we've got over 300 health and wellness items that you can buy in the catalog. And there's a dollar amount basically per member per household that every month you can buy so much from the catalog. Of course, we have our member website. We send, as far as Dr. Stone, doctor, correct? Eva? Okay. Right.
Well, yeah, but you don't need to say that. Eva is fine.
Okay. Thank you. Just wanted to check. You know, as far as how do we educate schools, and so I like frantically pinged somebody to find out, and we do have it's on the slide. We do send our value-added benefits guides to family resource and youth centers who work closely with schools. So they said that's how, you know, we kind of relay the information to schools, but I mean, that's a really good call out there. And, you know, really, you're talking about immunizations. That has been for all of us, all the MCOs, a huge focus because we have seen immunizations decline, you know, part of the COVID, whatever misinformation has spilled over, we've seen into other vaccinations, and we're seeing a reluctance. And so that's a huge thing. And that's something that all the MCOs, DMS has made a huge key with a value based program for all the MCOs that launches next year. And there are two of the 6 core measures, and I think 2 of them are related to immunization. So that's absolutely, you're right, all hands on deck thing. And we do, we train connectors, with Connect, and like I mentioned, the Family Resource Youth Centers. We do webinars and conferences about our value added benefits. We share them. We have, of course, all the MCOs, we have community events, all kinds of community events, and we share them there as well, any kind of member facing event. And then our carrier management team also shares them. As far as utilization, so for the prior full calendar year 2022, over 230,000 benefits. So that's benefits that were used. So there could be cases where you have a given member that's obtaining multiple benefits. So that doesn't mean 232,000 people, but it could be, because you could have some individuals getting multiple benefits. And we spent 9.1 million on that, on value added benefits for that calendar year. And how to receive them, the key thing with really all the MCOs, I think, is you call customer services, and we have a member homepage, but to your point, a lot of members don't have internet or reliable internet, but that's certainly an option. You get into the actually on the member homepage, you can create, members have to create create their own portal, because it has personal information in it, so they get access, and that's how they specifically that's one way they can request it, but they also just simply call our member services customer services number, and they'll arrange for it to be sent. Some of the benefits related to, like, for example, internet, we started doing this during the COVID pandemic, internet hotspot. If you got children 8 to 18 in the house, because we know that's critical, or for school. Of course, for a while schools were closed, but we've continued to do that. Obviously you need internet access to do your homework and stuff, so we've continued to do that. Tutoring is something else that we began launching then, about 3 years ago. We continue to do that as well for members 8 to 18. We do offer some scholarships, some $1,000 scholarships. A couple, something that we did last year that we continue to do is we offer, we pay for a state issued ID, which is absolutely critical. A lot of individuals, obviously, they don't have a driver's license. You need an ID for anything. And, there's been more focus on that in the past couple of years with different states. And so, you think about it, if you don't have a car, you don't have a driver's license, how do you prove your ID? So anyway, that's one thing that we've definitely seen has been popular. We pay for criminal record expungement as well. I know other plans do as well, which is critical for individuals who are reentering society. There's a lot of stuff. But anyway, I guess I'll just stop there, see if anybody has any questions. I do want to mention one thing a little bit related. All the MCOs, because this is really cool. All the MCOs a couple weeks ago had a free dental clinic day in Mayfield, Kentucky. We paid for a dentist to come in, and we had over 230 people, I think, that got dental care that day for free. And it began, I think, 7 a.m. People were already lined up to 7 p.m. And it was extremely well received. All the MCOs came together to do that. So I just want to mention that as well, since I'm talking.
That was a great thing. Thank you.
Yep, thanks.
Ashley with United.
Hey everyone, this is Suzanne. I'm the Population Health Director with United Healthcare, and Ashley Hobbs is our Enrollee Services Director, and she's going to go over the value-added benefits. I asked her to join me here today, but a couple of things I wanted to just speak to real quickly, as I've heard others. And thank you, Stuart, for shouting out about Mayfield. That was awesome. Dental is such a big issue across the state, dental providers and access to dentists. So thanks for talking that one up. That was awesome. So as far as United Healthcare, we provide many of the, similar services with regard to case management services, maternal health programs. We have a NICU case management program. We have chronic condition management programs. And we do remote monitoring programs. So we have hypertension. We focus on diabetes prevention, weight management, and we have platforms that provide remote monitoring. They get blood pressure cuffs for the hypertension program. They get a scale for the weight management and the diabetes prevention. We have platforms that members can access coaching through either telephonic or through an app. And they have 24/7 nurse monitoring as well. We have engagement tools through apps for different types of outreach, reminders, and educational tools for our members to access. We also, just as far as our immigration and refugee preparedness, I want to speak to that real quickly. We didn't include that in our slides, but I will speak to that. I think we're kind of in a unique position being the newest MCO here in Kentucky, and a lot of our members are all new, and I think we're like hitting, what is it, Ashley, 18 months, 20 months of continuous enrollment with the plan. So we're still, learning our population. And so we do see a lot of refugees and members who are working on immigration status. And so I feel like we've learned that along the way. We have a wonderful relationship with an interpretation and translation service. We're able to provide those services for our providers if they don't have it. And we also have that for our members. Our member services line can also access translation services, interpretation services. My care management teams, they can all do that as well. I have bilingual associates on our team. And then we have experienced multiple languages. So I think somebody mentioned Kinyarwandan. We were able to locate and source someone who spoke Kinyarwandan, and there was a dialect from Guatemala that was very specific that we, had to find someone that could provide interpretation for us as well for one of our moms that we were working with. And so through all of that, we also identified the challenge that our members have going into access care when they don't have someone, a family member that can translate for them, or the provider office isn't prepared for or knows how to access interpretation services. So we are able to, working with our members, we're able to set up in-person appointments to have an interpreter meet them at the doctor's office if that's needed. And so we've been able to do that this year. I was super excited about that. So Ashley, I want to have you go ahead and go into our value-added benefits that are available for our members. I know you'll probably see some things that are consistent across the MCOs, but I'll let Ashley tell you what's unique and what we offer for United Healthcare.
Thanks, Suzanne. Can you confirm you see the presentation on the screen?
Not yet. I just see your name on there.
Let me try that again. Do you happen to see it now?
I don't. Does anybody else? I don't see it. No, not yet. Ah, now it's something. Yep.
Did that work?
Yes.
Okay. I'm not as familiar with Teams or with Zoom. I'm more familiar with Teams, so my apologies on that. So like Suzanne said, my name is Ashley Hobbs. I am our Enrollee Services Director for the Kentucky Medicaid Plan here at UHC. To talk through some of our value-added services or value-added benefits, we're actively seeking feedback from our members through member advisory councils, surveys, community-based organizations and providers to understand what medical and social needs the members face. And then we try to be intentional in what value-added services we have, and then what we currently have, and then what we're looking to add in 2024 and beyond. Each of our value added benefits, there is a different method for the member to go through to request the service. So some value added benefits require the member to contact the member services number that's on the back of their card. Other benefits may be accessed directly through a subcontractor. So in general, our members don't really have to sign up for value added benefits. As long as they meet the general criteria, then they're eligible for the benefit. I won't read through all of these because there's 2 pages of them, but there's some that I want to highlight, and then definitely new ones that we're adding for 2024 based on the feedback we got from the community. So the ones that have the light blue background, those are going to be the new ones for 24. So you can see transportation. So 24 free one-way trips is going to be to community and medical services. So I think Aetna had something similar, but the grocery store, food banks, job interviews, baby showers, any type of social community setting. Could also be used for medical. We do know there's a transportation broker, so that's always going to be our first effort. But this is another backup if needed. Right now, we started this year, but if a mom attends her 6-8 week postpartum appointment, she can get a case of 200 diapers mailed directly to her home. That's been very successful. So we've added car seats to that as well. And this is not an or situation; it could be an and. So if the mom does attend that postpartum appointment, she can get diapers and a car seat if she wants. We also have a doula program. So this is going to. Oh, go ahead, Suzanne. Sorry.
I just wanted to throw in our moms also get meals. It's not on this. It's part of what we do for our maternity program. So when we call the mom post-discharge, at that first post-discharge call, they also receive 2 weeks of meals delivered to their home for mom and up to 4 members of their family. Go ahead.
Thanks, Suzanne.
Next. Yeah.
Perfect. Yep. And then we also have the doula program. So our pregnant members can get support during their pregnancy and then after. And this helps with SDOH, any resources they can be there. I believe it's up to 5 appointments, maybe more if they need it. They can also talk to them on the phone as well. Then we have our Boys and Girls Club, free membership. We have another new one for 24 is a health and hygiene healthy foods over-the-counter program. So members would be eligible for $25 a quarter is how we're breaking it up, but they would be able to get any over-the-counter type products like I'm sorry, like Q-tips. I was blanking on that word. Q-tips. They can get healthy foods like bananas, breads, anything like that. We have hundreds of retailers that are a part of the program, so members should have no issue being able to find one near them. We also are adding our GED Works. A couple of the other MCOs had this, but it'll be prep and testing for members who want to get their diploma. We're adding a new care tablet program. So we're looking at members with an A1C over 8 who live in a certain counties that have low access to PCPs. They have access barriers. So we're hoping to bridge that gap, any transportation issues they may have. We're hoping having the tablet and being more virtual will be able to help. One, was it on this? I guess it's not on here. One of the other ones that I wanted to talk about was our member advisory council. So some of the other MCOs have mentioned that. We have our member advisory council. We actually just had one Tuesday. So ours are virtual and on-site. So this past one, we had one virtual. We had a site at the Dare to Care location in Louisville, and then we had it at one at the Jessamine County Library. We had 6 members attend. Very successful. All of our members can get a $50 stipend for participating and providing their feedback. It's such valuable feedback. Oh, it's right here. Stipend for participating. Sorry. They can get $50. So they just have to fill out a form. We send it to them. It takes about 4 to 6 weeks to get it initially, but they can get that every time. They're quarterly. One of the successes we had on Tuesday's meeting, I went through a similar slide to this talking about our upcoming VABs. And one of our members was almost in tears. She had been wanting to get her GED for a while, and life just happened and got in the way. And I told her as soon as this went live 1/1, she could be our first person signed up. So it really, these BABs, I do a lot of presentations around these, but they really affect our members' lives. So that's why they're so important for us to listen to our community feedback. And then this Healthy Rewards members can earn gift cards for important services. And the slide just goes into a little bit more detail about what services the member can get. And then it's a $25 gift card if they were to close any of these gaps in care. Lastly, we do education through our community-facing website, our member portal, member handbook. We do through providers' offices, our community-based organizations, faith-based organizations, and then we have member materials we hand out when we're out in the community at different events or programs. And that's all I had. If there's any questions.
Thank you, Ashley.
Thanks.
Thanks.
Thank you. Excellent presentations, everybody.
Do we have anyone from Passport? No one
Hello.
dropped a name in the chat.
Oh, I'm sorry. I apologize. This is Anna Page from Passport Health Plans. I will be presenting today. I was wondering when I was going to come up.
I wasn't sure. There was no name in the chat. Give me
Yeah,
just a second.
Okay.
You should be able to share now.
Okay. Are y'all able to see the screen?
Not yet.
Okay. How about now?
Yep.
Perfect. Thank you. So I will go over some of the member incentives, and they are very similar to all of the other MCOs. So how are members educated on their incentives? Of course, when they enroll with the Medicaid Passport Plan, they do get a member packet containing all of the information about our healthy rewards and incentives, the welcome kit. Of course, our website, and I will talk a little bit in a minute if members don't have access to computer. Our website has a lot of information. This is just an example. I'll go into more. It's pretty small. That contains information on the healthy incentives and rewards. We have flyers on our website detailing the extra benefits. And we talk about what the members can receive and what they need to do to receive those additional rewards. For a member to receive some of the incentives, they have to fill out a attestation form that the provider also has to sign. So when you were talking about school-based services, you all can use that form and sign it if there is services provided to a member. So that is available on our web as well. We also send out a quarterly newsletter. And in every quarterly newsletter, there is something about the value added benefits and the rewards. It is also in our member handbook. So clearly we are advertising this quite a bit. These are the members that are available. Now the COVID was discontinued in July of 2023, but it was available at the beginning of the year. The majority of the incentives are based around gift cards. A little bit of that will be changing in 2024. But they get incentives for things like a diabetic retinal exam, prenatal visits. We had that for COVID, follow-up visits from an inpatient stay. We also offer the free phone and data plan, the sports and school and sports physicals, up to $100 for contact lenses, Weight Watchers programs. Blood pressure cuffs we were offering, but since those are now a covered benefit, those are not a value added benefit anymore. They're just under regular coverage. We offer GED, an exam voucher, and a gift card for passing. And we do have an extensive asthma program. Passport does have one-stop shops located throughout Kentucky. And we have one in Owensboro, Covington, Lexington, Hazard, Bowling Green, and a soon-to-be open one-stop shop in Louisville. That is where members can go and access a Passport person. We have computers there available for them to use. We're open Monday through Friday, 9 to 5. And we also do have community engagement events for those members who may not have access to our one-stop shop. We do have, as other MCOs, our community engagement events all throughout the state of Kentucky. Overall, in 2023, over 9,000 members received rewards. 35% of those were rewards for completing their HRAs. So what's new in 2024? We'll be offering credits, so members can earn up to $140 in gift cards if they get the immunizations, completing the HPV series, up to $125 in maternity credits, the free GE test, and the $50 gift card for passing is a benefit in 2023. And we have some incentives for using the smartphone. And to touch a little bit upon the refugee, we do have a case manager who is at the Kentucky Refugee Ministries and Catholic Health Charities who assist immigrants. We have not necessarily seen an increase in services, but what she has seen is an increase in demand for assisting members in getting on Medicaid. And that is all that Passport has. Any questions?
I just thank you for all of this, by the way. And so if I understood you correctly, then you all take an attestation form that's available on the website, and then does that have to come directly to you from the member, or can the provider submit that and then the member reach out to member services is my first question.
Yeah, the provider can't submit the form.
Okay.
Yeah.
Okay. Okay. And I was just as a random, I know you said that you all haven't seen an increase as far as immigrant refugees. We've gone from just under 8,000 multilingual learners in JCPS in 2018 to we're close to 18,000 multilingual learners at this point, predicted to be over 21,000 next year. So we are seeing a huge influx of immigrant refugees.
And I knew the impact was going to be huge.
Yes, she has seen an increase in members asking for assistance and how to get Medicaid, how to go to complete the forms and so forth. But as far as the case management, we've not seen an increase at this point, but looking at maybe increasing some of our exposure into the ministries and Catholic Health Charities.
Thanks so much.
Thank you all.
Yeah, thank you very much. Great presentations, everybody. Very informative, very well done. We appreciate the effort you put into that. New business, we have a data request, which will come back to us, right, at our next meeting. And Eva, you put update on CMS on the updated school-based Medicaid technical assistance guide and plans to get updated document to schools.
I just wanted to get an update for the TAC on the new technical assistance guide for schools and when that's going to be posted on the website for the school districts to access.
This is Justin Derringer with the Department for Medicaid Services, Division of Healthcare Policy. So that is completed and will be updated within the next couple of days, added to our website here in the Department for Medicaid Services. It will also be added to the website for the Kentucky Department of Education. And we're going to try to email those out to all the school districts as well, and all the schools that have signed up as school-based service providers. So that'll all be coming out. That just got approved this week, finalized. So that'll all be coming out within the next few days.
Thank you.
You're welcome.
And Dr. Stone, an update.
Oh, I'm laughing at you, Lisa. I just wanted to make sure the TAC was aware that, and Kentucky's been very progressive. And so, you know, hats off to DMS for all the work that's happened. But Kentucky was one of the earlier states to expand school-based Medicaid billing. to allow for services outside of a student's individual education plan. And so there's been a lot of work happen for that. And so as a state, you know, that's a great benefit to ensuring that children, it's just a great equity move to help ensure that all children have access to health care. And so when that work started, there is a national collaborative, Healthy Students Promising Futures, that has state committees for states that have groups who are working on expanded billing in their states. And so I just wanted to make the TAC aware that we've got this learning collaborative. It's been in place for some time, but it's got Erica and Annette from DMS are part of that group, Lindsay Kimbleton with Department of Education, and then some advocacy groups and some local school districts are part of that work. And so we have recognized, or we've set goals within our group for this year. And one is that the concern that not many school districts are taking advantage of this opportunity for expanded billing. So I think we've got 56 districts, that have signed up to participate in expanded billing out of our 171 districts. And so part of our work is going to be helping to educate districts. And I know that that's something that we just want to make sure that the TACs are aware of, that, you know, there is low participation on the school services. And this is physical health, mental health services as well. And so that's
That
really
would be valuable even to take to the MAC and make sure that that message gets presented there, I would think.
Well, I don't think there's, we have to vote on that, right, Lisa? So
yeah, we
that's
do.
something we would
do.
want to do. I think we've got to.
We will have to bump that, I'm afraid, but because of a lack of quorum. But
anyway,
This is Jen Wiseman. I don't know if I've been chiming in. I'm on my phone because I was leaving work when this meeting started. So I don't know if you all have accounted me as being here.
oh no, we didn't. We didn't know you were here.
Yeah, I've been here through the presentations. I got disconnected once and came back in. I don't know what's going on with my phone either. It says my video's on, but I don't see an image of myself. So I don't know if you guys can see me.
We can
yes.
now.
Okay.
Yeah.
Okay. I was like, my phone could be turned around and you could be seeing my couch right now.
And all it says is Zoom user. So that
Yeah.
might be why we didn't know you were there. That might be
Yeah, my phone has like a weird update. So but I had two suggestions. One, I feel like it's almost worth maybe to increase participation within the schools for a lot of this school-based health stuff. Is there like an education TAC or specific school-based TAC that would allow the opportunity for more school-based people to meet? Because I know we're the nursing TAC, and there's certainly nurses, you know, within school systems providing this care and billing and doing all that. But I'm just wondering, because there's so many issues related to schools, is that an option to have like a formal school or education healthcare TAC?
We have a children's TAC
Before
that
you
also
answer, just
tackles
one thing.
some of
I have a
these.
little emergency that's just happened at work. I have to step away.
Oh,
I'm going to pass this over to Dr. Eva Stone. I'm to close us out here because I know we're almost finished. I'm very sorry.
It's all right, Lisa. Are you guys still there?
So to answer your question, all of the TACs come from I'm sorry, I'm having a total brain not working moment. Legislation. Sorry, they all come down that way. So we do have the children's TAC that also does talk about a lot of school-based services. And I see Justin's hands raised and he's a subject expert. So I'm going to hand it off to him.
So we do there is a group of individuals that and Erica Jones would know what that group is called, but it's basically an advisory work group committee that has school nurses on it, has other providers on it, and they look at this topic. They look at they review the technical advisory guide that goes out to schools, but they also look at other topics of, how best to increase participation for school-based services and other care that's provided in schools to school-age children. They look at all the different topics that come up. We see from various provider types, and including schools. They send questions in, and we'll send that to that group to research, to look at. So there's all kinds of good work being done on that committee. So that's there's not a specific technical advisory committee as this one is, but there is a group of individuals that meet that are discussing these topics and have some amazing ideas to move forward. And we've already tackled a lot of problems so far in 2023. Erica Jones is the branch manager of the Child and Maternal Health branch. She's doing an amazing job to get rid of a lot of these roadblocks, remove some of the red tape, and clear the way for providers to be able to get some work done with these school-based services and providing care in school-based settings.
And Jenny, to just kind of add to that, so the different TACs look at it from a different, like there's a mental health TAC, and so the school-based issues are discussed in the mental health TAC. Nursing issues are significant to this TAC because it impacts nurses and clinical services as well. So when we look at value-based payments and ensuring that kids have access to care, it's a nursing and population health issue. It's discussed in the pediatric TAC. It's discussed in the equity TAC.
Well, I'm just thinking, and sorry, I don't know what's going on, if you all can still see me or if it's flipped my camera around. I just tried to log back in on my iPad, so I don't know what's going on. But anyway, I'm just thinking as far as like these presentations, like I would hate logistically for people to give these on 3 separate occasions or 4, you know what I'm saying? Because I feel like it's good information. And with a third, you were just talking about a third of, not even a third of school districts participating with the expanded billing and stuff. I was just thinking from a logistics standpoint, like how do you disseminate the information here to ensure that it's not just JCPS, that it truly is all the school systems are hearing what you get to hear because of being on the nursing TAC. So I guess my question is, how is this information, besides potentially going to the MAC and other TACs hearing it, how is the information that we're discovering and these benefits and the work that you're putting in to ensure that JCPS kids get, the most benefit out of programs offered to them? How is that being disseminated across the entire state?
So a couple things. So I can speak to JCPS, but the work isn't just about JCPS. So KNA has a school-based Nurse in Every School initiative. So there are multiple groups involved with that. So there's dissemination through that. The Healthy Students Promising Futures Collaborative I was just talking about, that's part of our agenda to disseminate information out to additional groups, that it gets out to school systems, that it gets out to the public. So there's more information. This information that the MCOs just presented is pertinent to everybody. I don't know if you were on at the very beginning when we were talking about how school-based services members can't access these claims,
yes, because they're submitted under the health base.
That's right.
Yes.
So this is information that needs to be out to the clinics and the providers so they can be sharing with patients how they can access these benefits. So it's not information that's just specific to one school district or even just to school-based care.
Right. I understand that. I guess my concern is, even when you look at professional organizations, I know the KNA is in charge of putting all of us here as nurses on this nursing TAC, but even in some of the most rural areas where they may benefit from this the most because they have the highest patient populations on these Medicaid plans in general, the nurses there are not members of the KNA.
Absolutely. That's right.
So
that's why,
you know what I'm saying?
I do.
Like, what's our goal in getting this information for, like, put anything school related aside? How do we get this information that we're being presented with as KNA members on this TAC to the nurses and providers and the APRNs in the areas that need it who are not even members of KNA?
So that's through the state school nurse listserv for nurses. There's also, and we have a learning collaborative for school nurses. We're starting, or we being the learning collaborative for the state,
Right.
starting a community of practice for mental health practitioners, who will also be groups that the information is disseminated out to. So, and then of course, you know, DMS has their process. I believe they're getting ready to do some work on communication out to districts and providers in general.
Okay. That was I mean, because even like the whole, you know, hemoglobin A1C of greater than 8 and the technology of getting them the ability to be more compliant through iPads, that's like phenomenal thinking. I'm sure that's going to be fairly effective, honestly, especially with our state right now, just putting in the initiative to get internet access across the state in general. So in my head, I'm thinking, this is great. We're looking at it, you know, you're able to help disseminate it to schools, but and all the other groups, but like, how are we getting to people unrelated to any, you know, just our providers who are not members of any professional association? They're just out there working and treating patients. Like, how?
Well, I think there are visits to the clinics, and the MCOs can speak to this better, but and I don't know if it varies by MCO, but like when I worked in a clinic, the MCOs visited on a regular basis and brought information about the benefits that their members could have. And I think a couple of you mentioned how you were doing that and disseminating this out to providers, correct?
Yes, this is Stuart with WellCare. We did, and we mentioned too, you know, we work with family resource youth centers as well, who also communicate with schools, and we educate them on what to share with schools. So that's another avenue.
But providers specifically, Stuart, outside of school districts.
Oh yes. We do share them with providers as well, educate providers as well.
Yeah, Anthem does as well. And we have a provider training program that has a virtual platform for them to log into. They can learn at their own pace, or we'll connect with them where they are.
Yep, same with United. We do a lot of provider education. We do a lot of outreach. And I believe we have like quarterly meetings with different topics where we do education. And then again, when we're in the community, we try to make sure that we educate folks. And we have people that go into provider offices. So like our community health workers will attend appointments sometimes with our members. They'll talk about information and try to help educate as well.
Thank you all.
Yeah, I'm just rattling my brain on how to try to help, because historically speaking, this TAC has been around for a long time. The 5 members who were on it up until we were all placed on this TAC were not active. And the way that this all came about to even start back up in the nursing TAC meeting, I just am not sure a lot of providers who work clinically know about this stuff at all. And so that's my goal. The more I'm learning about this, because I know I only work clinically. I do not work primary care. I do not offer a lot of these billable services with my ability as a nurse anesthetist. I just don't deal with immunizations and vaccines and trying to get people into the, you know, to that setting. But I do know, as a provider who does bill Medicaid, that a lot of, you know, MCO changes, MCO rules, things that would help providers treat more people, a lot of providers really don't know. The providers who are truly just treating patients, they don't know about any of this. And
yeah,
and that's why I'm bringing up the whole thing about the TAC. That the nursing TAC, and the way I discovered the nursing TAC was a Medicaid issue that I had.
Yeah.
And that's when I took it to the KNA, and the KNA was like, oh, well, we're supposed to be putting the people on this TAC. you know, and that was fairly recent. So I'm just trying to make sure that to save work for all the people at DMS and everybody, you know, presenting, that it's not needing to be duplicated, because that seems wasteful in time and energy to do the same presentations over and over. But I do think that we're getting such good information that I'm trying to ensure it's not just sent one direction, that we're truly, even as a TAC, helping these MCOs figure out how to reach our colleagues, because I'm not that they're all being reached. I understand that it's the same with kids. The options are out there, but they're not utilizing the options. The MCOs are taking the time to put the options out there for these providers to log in and get this training and understand, but they're not doing it. So, you know, how do we bridge that gap, I guess, is my.
Jennifer, this is Erin with DMS. If I could step in for just a minute.
Sure.
We do have several TACs that work in conjunction with each other. Just recently, the chair from, I believe it was the therapy TAC, had an issue he wanted to bring to the physicians TAC. So we did some emails, we got them on the agenda. I think when it comes to school-based services in particular, you guys in the children's TAC may have some agenda items that you guys could maybe work hand in hand with. We do have a lot of TACs that work together. We do have a lot of presentations that are given over and over, and I'm sure MCOs they just switch the names on them and update them just a tad, and which we're always happy to do. But one of the things as far as getting that information out to the public that I wanted to address, one, invite people to these meetings. They're open to the public. Two, that was another thing. That's another thing that I think is wonderful about the taxes. You guys bring some issues here. We bring information back and you guys help us. I know DMS does provider letters. We do stuff all over our websites. Our MCO partners are wonderful about sending out the same notifications. However, it's you guys out in the field who say, Jennifer, you know, this nurse that works in this place over here who isn't a part of the association, who's never heard of the TAC meetings. Let them know, hey, this is some information I heard. And so we are hoping that the providers are also, you guys are also going back out into your fields and sharing the information that you're learning and gathering any questions. You know, the nurse you may reach out to, hey, I was in this meeting, we're talking about value added services, and they may say, what are you talking about? And so you're able to help share and educate along with us to people that we may not always get to be in contact with daily. So I always encourage everybody to invite people to these meetings. They're open forums, they're completely open to the public. If you come across someone who you're educating on something and they have questions, write them down and add them to your agenda. You're always welcome to email me and I can send them out to the MCO partner or someone within DMS and try to get you answers before your next meeting. So that is our hope, is that the members of the TAC are also helping DMS and the MCO partners help funnel as much information out as we can to some of those providers we might not be reaching in other manners.
Yeah.
Jenny, you're the listserv, like I'm no longer on the coalition's listserv. I'm not part of that group anymore, but you have or your nurse anesthetist group. A lot of the questions and things that end up on the agenda, if I request it be on there, it's because I've seen it from our communities of practice or there's questions that have come my way. So this group isn't all about school-based health. It just turns out that way because that's where the questions are coming from right now.
Right. No, I get, and I wasn't trying to say that it's that way. I was just thinking along the lines of how do we disseminate, information in general, especially this school stuff, because like JCPS is fortunate to have you and have you here and participating so you can ensure relay to that district. Do you know what I'm saying? But and I don't know any other school-based meetings beyond that because I'm not in any school-based anything.
Right.
So that I was asking that, but even more, I was just asking, along the lines of us as members sitting here right now, how are we going to help get this out? Because, like I said, a lot of people who are truly just treating patients, they're not the ones logging in. To read this on the DMS website or the MCO website. I mean, at best, they're going to call an MCO if there's a billing problem. You know what I'm saying?
Yeah, yeah.
But I think it's great information. That's just kind of, I was asking for others, like, what's the best way to go about helping this get pushed?
I think it's a good question. Thank you. And the only other thing, and I see that we are at time, is just a data request for last year on expanded billing in schools to look at what types of services were provided by quarter for expanded billing. I know those have the 99 modifier, so hopefully that's something that, and that actually might feed in a little bit to Jenny's point. What services are being provided, where are their gaps, and then how do we use that data to educate providers in Kentucky about opportunities to partner.
And maybe maybe there's a way to even have data pulled that just says, you know, what are the 15 lowest counties utilizing these services? And maybe K&A can take a role and say, okay, we're going to contact people in this area who are members and let them know, because statistically these areas are not taking advantage of this. You know,
Erica
maybe
Jones has her hand raised. Oh, sorry, Jennifer. Erica.
Hi, good afternoon. And I know we're short on time, so I'll try to make this brief. We did get the data yesterday for state fiscal year 2022 on the school-based services, and we can present that at our next TAC meeting. But just a couple of highlights. We have noticed already that there is an increase in services from state fiscal year 22 to 23. So there was a total of 15,612 claims in fiscal year 22, and of very incomplete data as of now for 2023. Of course, school districts have until June 30th of 2024 to submit their final claims for that state fiscal year. But already we are over 6,000 additional claims for the newer, yes.
Mm-hmm.
And then we had 2,486 members served in fiscal year 22. We have already over 6,600 members served for state fiscal year 23. So we are on the right trajectory. It's still, you know, a process. And we do have a survey that is going out to every single school. And that's going out in January. It's a comprehensive survey asking them if they participate in school-based services. If they do, what type of services are they performing? If it's strictly IEP, if they're involved in expanded access. If they're not, what are those concerns? What are some barriers so we know what we need to address? And also if they're partnering with FQHCs or rural health centers, because we wouldn't see that data as school-based services, but that doesn't mean that there aren't services being provided in the school setting. So we're just wanting to see like that comprehensive picture of what's actually being done in the schools so we can better serve our members there.
Thank you, Erica. Okay, everybody, is there anything else? I believe our next meeting is scheduled for February 15th. Do we have to formally adjourn? It's just you and I without Lisa.
I'll make a motion if I need to.
Second it.
Thank you, everybody.
Thanks, everyone.
Everybody have a great rest of the day.
You too.